Welcome to the City Current Radio Show. I'm your host, Jeremy Park. We hear a lot about what's going on around the globe, especially in India with, sadly, the COVID-19 pandemic. And so here with us is a friend of ours who is someone that we've had a chance to interview before, talking about what she does on the professional side, but now she's going to talk about what she's seeing in India, in her home country, on the personal side, and help us to have a better perspective of what's going on globally, but also, too, how we can help. And so we're joined by our friend, Dr. Krishna Sree. How are you doing?
Hi, sir. I'm good. How about you?
Doing well. So we want to obviously be able to help you and better understand what you're seeing there in India. And so let's start. Give us a little bit of just kind of where you are in India and just kind of talk about what you're seeing right now.
Yeah, sir. Actually, this COVID it's really a toughest part in each and everyone's life. So before years, we were just thinking about many other disasters, natural disasters, and something like that. We were afraid of that. But really, in this situation, everyone are afraid of COVID. So because of this COVID, many one's normal life has been just become upside down. So I'm from India. So especially I'm from Tamil Nadu. I'm a Tamilian. So in our place, really, we are in need of help, and our government is taking good steps to improve this situation. They are supporting the patients a lot. They are moreover that each and every patient's families are given with some funds. So like that, we are helping. Moreover, we are helping. So, but we are in need of some help from different peoples. So those who can give funds to our government, they can give. So first, let me tell what is the situation currently is going on. So here, it's a sad part that nearly moreover 10,000 people per day they are dying, and their families are really facing many troubles, because if a person who is educated, suppose for example, only one person will be educated from a family, so he needs to take care of his family. So if he is gone, who will be taking care of that family? So there will be no one to take care of that family. And likewise, many situations are there. So more deaths are here, and we are trying our level best to give the treatments and to provide what are the necessities they are facing. We are trying to give that, but we are in need of some funds. So I request you and your team and your colleagues to support us in this situation. I'm expecting a good support from you. Yeah.
And so talk about where the, on our end, where can we show support? So where can we go to give? You mentioned the government. Where can we go to help in terms of online or making donations? Where would you recommend that we go to help?
Yeah, sir. So there are many organizations like both on the non-organization like related to government and non-government organizations are supporting this COVID-related issues. They are really doing a good job. And I'm thanking each and everyone who had sent their funds to our country, really even from your country and from different parts of the world, they have been sending their funds. So I'm really thanking them. And you can send the funds directly to the PMO's fund, Prime Minister of India. To his fund you can send. So for Tamil Nadu, you can send the fund to the Tamil Nadu government's fund. So MK Stalin, he's our chief minister. So you can send fund to chief minister's fund. So he's the newly elected chief minister. So when he came into this field itself, like when he is coming into this in this crisis, so he just made really he's doing good, and he's really supporting our people. And he's also requesting many people to give their funds and contribute many things and all. So you can just directly, you do not believe anyone, you can just directly provide the fund to our government itself. Prime Minister of India or Chief Minister of Tamil Nadu or any part of India. You can give to any part of India. It is not that you should give to Tamil Nadu. You can give to any part of India. Any Chief Minister's fund, you can donate your funds. It's not that you should give a high amount. What is there with you? So that's really enough. We are not expecting more, but we are expecting more people to donate. That's what. We are not expecting more money from a single person. Many person can donate, little bit of amount. So that makes a big ocean.
Absolutely. And just for perspective, if you look at the recent news, 8 million infections a day, which is roughly the size of New York City, the whole population. And when you look at the death toll right now, sadly, it's over 258,000, but they really estimate it's 750,000, so over 750,000. The population of India overall, 1.4 billion people. And when you look at 23.7 million cases right now, so it is a devastating, effect and impact right now in terms of what it's doing. Are you seeing things like, obviously, the vaccine, social distancing? What are the things that you're seeing on your end as the protection mechanisms for, your country? Are they doing the 6 feet of separation, the masks, all that kind of stuff?
Yeah, sir. So really, so wearing mask is must in India. So it's really made mask, So if you're not wearing, you are into a punishable state. Punished, you should pay fine. So because we don't know. So later, when there was a first wave of COVID, there were news that it is not related to airborne disease. So, but in the second wave of COVID, they are saying that it is depending upon the distribution is according to airborne disease, something they are saying like that. So we should be, every individual should be take responsible. They should maintain social distance. So here we are maintaining social distance. So if we are into a good malls or supermarkets or each and every shops, we maintain that social distance. So there will be some marks denoting somewhere and all. So you should be at that social distancing. If you're not maintaining that also, you'll be punished. So mask is really must. That also, normal mask is not allowed. You should wear a perfect and good mask. So some people, what they do is they used to wear a single mask throughout the day. So really, there was a research that shows that wearing that mask throughout the day, it leads to some sorts of airborne diseases in that person. So he is prone to other respiratory diseases. So what people are thinking is that they need to come out from escape. They need to escape from the police. They are not focusing upon their own health. Just if they are seeing the police, they used to wear their mask. That's it. So now it's made strict that you should wear a good mask. So that is one thing. Social distancing, yes, of course, we are practicing social distancing. And next thing, what we are doing here is vaccination is made must. So everyone are requested above the age of 18. So government authorities to take vaccination. So Prime Minister of India is also mainly focusing on vaccination. So many celebrities and other many authorities, government authorities, they are promoting the people to take vaccination. They are just uploading their photos. So by seeing that, that people could get aware and get vaccine. So next thing is really, in my point of view, so allopathic medicine, allopathy doctors, they are doing their best. Yeah, of course, we should salute the doctors, nurse, and every medical related workers and other corporation workers. But really, natural remedies, which plays an important role. So no one can say no. No one can shake no to that. Really, natural remedies plays an important role. I can say you that 100% I can assure that. Really, because in each and every allopathic hospitals and every hospitals, they are practicing natural remedies too. So that plays an important role. So by mixing allopathic treatment and naturopathic treatment or other Indian medicines, so we are combining both allopathy. So we are getting good results too.
Talk about some of those natural remedies. Give us an idea of just some of the natural remedies that you've seen that have worked well.
Yeah. So actually, sir, in this situation, you should have a strong immunity. So your immune system, which plays an important role. So if a person is really having good immune system, he is prone lately to the disease. We cannot completely say that he cannot get affected with that disease, but he may get lately prone or he may not prone to disease. So to improve that immune system, what we are focusing is good diet. So in our hospitals, in our Tamil Nadu, I'm just speaking about Tamil Nadu. So in Tamil Nadu, what we are doing is in every government hospitals, we used to give a proper good diet, balanced diet for improving their immunity. So example, protein, vitamins, minerals, everything is balanced. So we used to give expectorant juice. So expectorant property is more in like citrus fruits. So orange, so lemon juice. So if you're taking these steps, you'll get your immune step. So other than this, I request and I say everyone to take gargling. So gargling using just turmeric and water, hot water and salt. So this is must daily, please at least do 3 times, or even at morning and night, you just do gargling. So it's really a good remedy because the virus, or if anything is in your respiratory tract or in your food tract, so everything will be cleansed if you're practicing gargling. So that is the first thing. Next thing is steam inhalation. So if you're doing steam inhalation, that is using natural herbs. So neem is the good medicine. Basil leaves. So basil leaves, turmeric. So this much is enough. So using this, you should boil these leaves, and using this, you should do the steam inhalation. So while you're doing the steam inhalation, your whole respiratory tract is cleansed. Your nasal tract and other every areas are cleansed, and you cannot you can come out from this infectious diseases. So your whole respiratory tract will be cleansed. So you can practice steam inhalation. So other than this, we are giving yogic practices. So yoga really plays an important role. So we used to practice different mudras, different exercises, breathing techniques. So we practice these sorts of techniques for coming out from COVID related issues. So especially I can say one of the mudra, yoga mudra, so which are giving to our patients. So I'll just practice. So your hands should be like this. You should tie your hands like this. Your finger should be like this. This is called as Linga Mudra. This is called as Linga Mudra. L-I-N-G-A-M-U-D-H-R-A, Linga Mudra. So while you're practicing this, you're giving some pressure. So while you're practicing this mudra, there will be a heat production. So using this heat production, oxygen level will be increased, so that for it is really good for the COVID patient who are suffering from oxygen. See, for getting oxygen cylinders, we are just requesting everyone to provide funds and all. So for getting proper oxygen supply, you can practice this mudra, Linga Mudra. It really plays an important role. Scientific reasons are also there. So other than this, we practice asanas, exercise, breathing exercise, which expands the lungs. So this area, which expands the chest region. So that kind of asanas and exercises, breathing techniques were practiced. And so using that, your lung expansion will be increased and oxygen intake will be increased. So by these practicing diet, good diet, yoga, breathing exercise, so steam inhalation, gargling, and other herbal remedies, we are treating our COVID patients, and we are getting good results too.
Yeah, I like it. Very helpful advice. What are some of the recommendations when it comes to the mental and the psychological health? Because that plays a big part as well. So talk about mental health and the psychological impact on this.
Yes, sir. So really, this is a good question for you. So really, psychology or mental health. Already we have talked according regarding this mental health and all. So really, mental health plays an important role. So this COVID patients. So mainly we are focusing this COVID patients. They are mentally disturbed. So they will be having some fear inside themselves, like will I die, or will something happen to me? So will I get enough medicine? Or if they are feeling good also, if they are okay also, their mental health, if they are weak in their mental side, really they'll be prone to different diseases. So example, if they are over depressed or if they are having high BP and all, oxygen level will be decreased or increased. Okay, so due to that, they may get some respiratory attack, and this leads to death also. So mental health is really playing an important role. So what we used to do is, after finishing this yogic treatments and other treatments, we used to talk to people. We used to talk to the patients. we used to give yogic counseling. So by giving this psychological counseling to the patient and to their family, we can come out from there, or we can make the patient mentally healthy. So if they are healthier through their mental wise, really, it's really good. So we used to consider the mental health as the best thing and first thing. And every day, each and every day, we used to give counseling to the patients. So by giving this counseling, they are becoming stronger. Yeah, really, they are becoming stronger day by day, and they are coming out from the disease. So mental health really plays an important role in this COVID patient. Not only in patient, also in other staffs also. So if we are making other staffs and other people around us happy and making them mentally strong, they'll be working more together, and they will also treat the patients good. And yeah, they'll be happy. So mental health plays an important role. So psychological counseling plays an important role.
So go ahead and wrap up with where listeners and viewers of the video can go to just follow you personally and learn more. So where can we go to learn more and follow you?
We need funds. We need funds for our country. So if each and everyone from your side, from your country, if they're helping, it would be helpful to us. So I request you to make this video reach or go around viral. So that is what I'm not focusing any organization or anybody particular thing. So I know you'll be doing the best. So really, I trust you. You're a good friend of mine, and you have done lots of help to many people, and you are an inspiring person to many people. So you are a good motivational speaker. So Dani, you know better. So I believe in that. So I just want from your side, what I want from your side is I need a good help, that good fund from your side for our country. That's it. Nothing else.
That's why we love you. It's not about you. It's about helping your friends and family and people. So thank you very much for coming on the show and sharing what you're seeing on your end. And we'll make sure and share the link and encourage everyone to donate and be a part of the relief effort. So thank you, Dr. Sree, for everything you do. Thank you for coming on the show.
Thank you, sir. Thank you. Thank you so much.